All right. I think we're about there. Exciting. Hey, everybody. Happy Friday. Hey, Robyn, how's it going?
It's great. Dr. Linda, how are you?
I'm great. So, guys, welcome to Feel Good Friday. And I'm here with the incredible head of the Alzheimer's Alternative, Robyn Albaum, who is a certified health coach who works on helping people keep their memory, get their memory better. And she's so amazing. And very, very excited to be here this morning with you to talk about how we can optimize y'all's brain, right? Memory, get better. And what we know is that memory loss does not have to be a one-way street, right?
Absolutely not.
It doesn't have to be a one-way street, guys. So if you're feeling like you have brain fog and are having memory problems today, we're going to talk about some very concrete tips for you that you're going to be able to use in order to make a big difference in your brain. Um,
I'm going to
so,
introduce you. Let me introduce you. Yes, this is
yeah, right.
maybe you don't know who you're listening to, the fabulous
Oh,
Dr. Linda Goggin. She's in Washington State, Feel Good Functional Medicine as a functional medicine physician there, and also at Paloma Health. So we're really excited to be together. We've known each other for several years now, right? Yep,
yeah,
yep.
we have. Yeah,
Yep.
we have. And we have helped a lot of people feel better and also have improvement in their cognition. We both have been trained in something called the Recode Protocol, which I think it's now time. Let's put out some kudos for Dr. Dale Bredesen, who is the only person, right? I mean, now people are getting on board, but the only person to recognize that Alzheimer's and memory decline, it's a bunch of different things. It is not just one thing. And Robyn and I do what we call root cause reversal and trying to identify what's the source of the issues with your brain and how can we get it better. And both of us have seen people with significant memory problems improve, and people who were declining quickly level off when you do this thing called root cause resolution. And Dale's book, The End of Alzheimer's, is a must read for everybody. If you have,
Here's,
yeah. Oh,
here's
you got it right there.
the new
Um,
one, the new
oh, The
book.
Ageless Brain. Oh my gosh, I have not read this book yet. I'm so excited.
Just just came out like literally 2 weeks ago, guys. This is the new book.
All right, so everybody, let's go to the bookstore and get The Ageless Brain, and we're going to talk about one of the most important aspects of brain health. And Robyn, how'd you
Yeah.
sleep last night?
You know what? Last night was not a good example, but normally, and I know what caused it, but sleep is so vital. And I can tell on the days when I'm really consistent, which is, 90% of the time,
Yep.
how much better I'm thinking, moving through my day, maybe not even experiencing that lull at 3 o'clock. So it really makes a big difference.
Yeah. I mean, the research shows us that people who sleep better have a reduction in pain, an improvement in cognition, an improvement in energy. So I know I'm preaching to the choir here because all of you guys know you need to sleep. And probably 10% of you are like, I don't sleep good. Um, so this is a really important place where we can get a significant improvement in brain fog and cognition if we can get people sleeping better. So, Robyn, what are the first things you tell somebody when we're trying to help them sleep?
Yes. So timing is important and it's unique to the person. There's people who are just genetically prone to be night owls, maybe not as much, and people who are like the average kind of Joe and Jane between like, 10 and get up at 6, 8 hour standard, or people who go to bed even earlier. So it depends on what your lifestyle's like, but important to kind of be consistent at least. So just be consistent. Just
Yeah,
keep even on the weekends. And I know, guys, you might be out having a good time somewhere, but and once in a while, hey, that's life. But try to get back on track right away because your body looks for that consistent pattern, your circadian.
right. 100%. If someone comes to me with insomnia, the absolute first intervention, well, maybe the first intervention is tracking exactly what's happening, like how long they're actually sleeping. Right. Some of us go and lay in bed for 8 hours. But after tracking their sleep and like how often they're getting up, how much time they're actually sleeping, the first intervention for insomnia is setting a regular wake up time, because our body needs that rhythm. And it is best if that rhythm follows the light.
Yes.
It our body and our eyes and our brain respond to that input of the light. And so a way that we can start to entrain people's sleeping is by using light, full spectrum light, 30 minutes in the morning. Have you guys heard of a happy light? Have you ever used a happy light, Robyn?
I haven't. Tell me about that. I haven't.
Well, so a happy light in the Pacific Northwest, I think everybody should have a happy light. It is a full spectrum light that you sit on your breakfast table for 30 minutes that has been shown to help with seasonal affective disorder.
Mm.
And part of it is because in the Pacific Northwest, it's so dark in the mornings, you don't have you don't have light, sunlight. And for some people, that can make a huge difference in their mood, right? And it certainly can make a difference in sleep as well. So trying to get on a nice rhythm where your body says, okay, this is what we're doing. All right, we're getting up, and setting a regular wake up time is absolutely essential, and the first intervention that we have people do. So then a happy light is having full spectrum light in the morning, actually looking not at the sun, but at the sky, right? Getting that in front of the windows. And then the evening time, what do you tell people about light in the evening times when you're coaching them?
Yeah. So getting off your phone, right? You got to kind of
Right.
try to wind down. I know this is a tough one, and your screen, any screen really. So a way to combat that, if that's not easy for you to do, and maybe you're somebody who works more in the evening, or you're a student and you're studying or what have you, or doing a course at night, get yourself some blue blockers. The glasses. I don't have mine handy to show you, but there's some really good ones out there. Oh, see, she's demonstrating. Woohoo! She had them
These
already.
are cool because they have they're magnetic.
That's
These are
perfect.
called, yeah. So this doesn't work for everybody, right? The blue blockers. But some people don't notice a big difference. And these are called Viva rays. But it's nice because you can put the orange ones on at night.
For the
Uh,
nighttime and for daytime,
it,
right, right.
Blue blockers could be helpful for you. You don't know unless you try. I don't think that the little, the glasses that they sell on Amazon that are just kind of like the sort of slightly tinted, I don't think those make a big difference. I think if you're going to you want to find out if it really helps, you need to get some serious blue blockers.
Yeah.
Um,
I mean, I've used, some that are not as expensive. And if I put those babies on when I'm watching TV, 45 minutes, I'm like tired. And there's a marked difference in how I feel. So I don't know what the percentage of that is for
yeah.
people, but if you're not somebody who responds to those glasses, then just, try to reduce your screen time, a
Yeah.
couple hours before bed, really.
It's kind of the low hanging fruit. Like what's inexpensive? What can we try? And reducing screens, having that nighttime routine. I've even seen some people like put orange lights into their light bulbs into their bedside table so that they're
Yes.
getting more like the sunset, which I think is very nice, right? So you're winding down in a routine way every day. The other thing with regards to light is that there's some studies showing near infrared and red light in the evenings worn on the head has been shown to improve sleep. So
Mm, mm,
that
mhm.
was using the NeuroV. Is it called the NeuroV? That
By light,
V light, yeah, the V
right?
light.
DEI. Yeah.
They did some research looking at how that affected people's sleep. So anytime we're dealing with brain function, sleep is so important, not just because you get refreshed, but that's when you detox your brain, right?
Yeah. I was just going to bring that up. Yeah.
Yeah. Um, and so when we sleep, of course, we change the pattern of blood flow in our brain so that we are really doing a deep cleaning of the brain.
And it
And
shrinks, right?
yeah,
It actually shrinks and it kind of goes through like a bathing process. And it's like, wow, who knew?
right,
But the
flushing out the
cellular,
system.
yeah, the cellular debris gets washed away. If there's any amyloid plaque, that's supposed to be clearing as well. So super duper important to get into the deep sleep.
Yeah. Well, and the other thing that when we're talking about blue light, there's been studies showing that blue light in the evenings reduces your deep sleep, and it also will reduce the melatonin production. So melatonin kind of gets you sleeping in the night, and so it's important that the melatonin levels rise in the evening. And for those of you who are taking melatonin, I didn't know this for such a long time, but we need to take this a couple of hours before we go to sleep. And, for so many years, I sort of tried a little melatonin, it wasn't really helping. But when I did that, and that is one of the supplements that I do take, I feel like it helps a lot. I started to get great sleep, um, except for when stuff hurts. So let's talk about how we can reduce pain, because who is
You
awakened
are.
by pain?
Yeah, yeah, for
This is
sure.
so,
Sure.
it's so common. And there have been some studies showing things like red light can help with pain. The other non-pharmaceutical interventions, because we're all about trying to do things naturally if possible. I love turmeric as a supplement. It's one of those things that we suggest for all of the recode people, right?
It is.
To take some turmeric or curcumin. Curcumin is the form that we say typically recommend. But reducing inflammation in the body and reducing pain can help people sleep. And so I think that is important intervention. And then we use light therapy of other forms. We use some light phototherapy patches that can bring dramatic improvement in people's discomfort and help a lot of things. So that's something that I feel like has made a big change in over the past several years when I've been using them more in the patients using phototherapy patches. Um, what other big things when you think of to help people with sleeping? So we're thinking about pain, so reducing, fixing the light situation,
Yep.
reduction of pain. Um,
Well, when going back to the light, and I don't think people realize this, but how much light is sneaking through your curtains or your blinds? Oh my gosh, it's a much bigger factor than you would ever think. Yes, mask. So it can be a simple solution, right? Get like a little mask and stick it on, maybe put your hair in rollers like the 1950s. I'm just teasing. But I do that. That works really, really
I
well.
don't know. Those hair rollers never worked for me. In fact, I could not sleep.
The mask
I could
works well.
not sleep with those hair
Yeah,
rollers. They were
yeah,
so.
yeah.
Do you remember? Did y'all ever curl up your hair in socks when you were a kid? That's what
But
we
we used
used
to
to
do
do for
rags.
curlers.
Yeah, my mother used to do rags. Like that
Yeah,
was a thing in England. They would do
so
rags.
uncomfortable. How do we sleep in that? Yes, the sleep mask is essential, and blackout curtains if you can
Blackout
get
curtains.
them,
Yeah,
right? Oh my
totally,
gosh,
totally.
so big.
You got to put on an alarm though, because you'll keep sleeping.
It's true because you wake up and you think it's the middle of the night.
Yeah,
So really, really good points.
yeah.
Um, let's see. Do we beat that horse enough? I think
Huh?
so. I'm
Temperature.
trying. Yeah.
The
Okay,
temperature.
good. Yeah. I mean, I think that the dark, you need it dark, guys. Dark and quiet or with white noise. White noise can be helpful because if you're in a house with like I've got teenagers that are up all night and I've got to have white noise on or I'd be waking up every minute, right? Like, oh, they're walking down the stairs, right? So pets, golly gee. This is a tough one because everybody likes to have their animals around. If you've got a dog, take off their jingles at night if they have to be in the bedroom with you, so that at least their jingles are not waking you up. And some people, I'm going to put it out there that some people sleep fine with their pets. The only way you know is if you track, right?
That's true.
So
That's true.
tracking can let you know, but usually we say pets out of the bedroom is the best way to sleep. I know I have a cat, the cat that would she just come put her paw on me. She's like, just making sure you're there. And I'd be like, yeah, yes, I'm here. And I was fast asleep until you touched me on the cheek. Do you guys kennel up your dog?
We do at night. Yeah, he likes his crate. It's very cozy in there. I bought nice little
Oh,
organic
great
thing.
training a dog is the way to go.
He goes right in. And it's like that's his place. If you try walking that crate out the door, if we're going somewhere, taking him with it, oh, he's like, what are you doing with my bed? So yeah. But he comes up to us in the morning. So it's kind of like even if you feel weird about doing that, dogs do love dens, by the way.
Yeah,
That's
right. Well,
fun.
and it gives them a safe place.
And then he
We've
jumps
been,
up.
because I have a puppy who
Yeah.
we're crate training right now. She seems to like it in there. Okay, so pets, quiet or white noise, dark,
Yeah.
cool. our body has a circadian temperature that shifts, right? Our body needs to be cooler at night. And
Mhm.
if you are not, so yeah, ladies, you're having hot flashes, got to get that taken care of because that will totally wreck your sleep.
Yes,
Hot flashes are more than just getting hot. They disrupt a lot of things. So getting your hot flashes managed with your doctor is really important.
yes.
And then, temperature at
Temperature.
night.
Mhm.
Have you had any patients try like these cooling mattresses or anything like that?
They haven't, but they're keeping temperature pretty low. Some
Yeah.
people as low as like 66, 67, which in Charlotte is kind of pretty cool. Um, yeah, we're probably a little bit closer to 69, but and then I haven't heard about the cooling mattresses. Do you have anybody who's used them?
Well, I just hear all these they're kind of expensive, right? They're
Yeah,
mattresses that you can set the temperature on. And I would say if you're going to use something, there's lots of ways to cool down, right? A fan could be a way to cool down, turning down your thermostat.
yeah,
One of these fancy things like a cooling eye mask. Um, but
sure.
my big concern is could it get too cold? Because we know cold hands and feet will keep you awake.
Yes,
And if you have cold hands and feet, all my friends with hypothyroidism, put socks on your feet and you will sleep better. That
absolutely.
it's so important. So you just won't know how much better you're going to sleep until you have really warm feet if you have cold feet at night. Um, but the rest of you want to be cool. And you know, that you can do that in different ways, but manage hot flashes, get a fan on you. I
I'm
think
a
these are all
fan.
reasonable.
Another
Yeah.
another another easy thing that can be done, and seems to work initially at least, is take a shower at night. And then your body temperature is higher, and then when you get into bed, it's starting to cool you down, so it kind of gets into that kind of rhythm.
Love that. Yep. So that can be warm bath or shower, and
Yes.
that will be very helpful. So we've got temperature controlled now. We're staying cool at night. Um, if you have something like sleep apnea, y'all, you got to get that taken care of because poor sleep over a lifetime is going to lead to brain problems, and it definitely leads to brain fog, all the things we're talking about, low energy and that sort of thing. Um, the other thing I want to mention is what if your brain is racing at night? And I was just reintroduced to an idea. I've been a family doctor for a long time, and I used to always just suggest sleep restriction. Let me back up. If your brain is racing at night and you're worrying, you're waking up going, I've got so many things on my mind, that things I got to get done. Well, this is this is probably important to you. And one idea is to actually say, well, I'm waking up worrying. Wouldn't it be great if I was worrying during the day instead of at night? And for 2 weeks, here's the cure to that. Set a time during the day when you're going to think about all those things that you think about at night. If something's important in our lives, we schedule it. And if we are worrying about something, it means that there's something that needs to be done and managed. So
Mhm.
instead, so you have to do this for a while. If this is part of cognitive behavioral therapy for insomnia, is like if worries are keeping you up at night, you need to schedule that stuff during the day and like say, all right, I'm going to take 15 minutes, 30 minutes, however long you need, an hour, if you have a lot of things to think about and process, that you can like take care of the worries that would be waking you up at night.
Work through it. Yeah.
So that's one strategy.
Oh,
Um,
meditation.
oh, meditation. Yes, we know that meditation can make a difference. And so how do you tell people to start off if they're like, I can't meditate? What do you say to them?
Uh, I think their fear is that it's going to be for a really long time. So I say, just start with a few minutes,
Right.
just a few minutes, just something to quiet your mind, closing your eyes wherever you are, and just letting it drift. And just if there's a lot of thoughts coming through, it's okay. That happens. Just let them pass. Let it pass. Don't attach to them, but let them move through. And I think the more you practice that, the more your body and your brain gets used to it. And before long, instead of 5 minutes, maybe you could do 10 or 15.
Yeah. I mean, it is such a skill. It is a skill that you can get better at, and it will improve all of your cognition. You'll be able to focus on tasks better. You'll be more relaxed. It improves the mood.
Yeah.
I feel as though when I fall off the wagon, off my meditation wagon, I become much less effective as a person. And then I, just like all you guys, when
Yeah.
I start back, it's like hard to sit, I mean, I go in times of my life when I'm meditating like long periods of time, like an hour would be easy at some points. Right now, it's not. The puppy made me fall off my meditation wagon because first off, I like to meditate my sauna, but I couldn't go in there because the dog was going to chew up my life out there. Um, and so now that she's just getting older, I'm starting to be able to go back in, but I'm starting with, 10 minutes, 15 minutes, and take the little wins, guys. If
Yes.
it's 3 minutes, that's a win, and you can extend it, and it's going to make a huge difference in
Yep.
a lot of things. Because when we meditate more, our cortisol levels, that's a stress hormone, will start to get more regulated. And that, if over the day your cortisol should be falling, but if we're keeping a high cortisol level because of our stress and all this through the day, then it's going to affect sleep.
Imaging. Yeah.
So that meditation can definitely help with sleep.
There's some good
Um,
apps for it too.
do what?
Some good apps that they can get access to, like Calm and Insight Timer. So real
Yes.
easy. I mean, it doesn't have to be hard. You don't have to take a course necessarily unless you eventually want to do that. But there are many, many ways to find meditation apps, or even just going onto YouTube and say meditation for sleep.
Right,
Short
right.
meditation for sleep, and it'll pop up. So, and whatever suits you. Some people like to have guided meditation where they're hearing the voice speaking to them, into lulling them into that mindset, or just sounds of waves, or the ocean, and or
Yeah.
birds chirping, whatever works for you. So
Yeah, have you ever tried the Muse headband? I like the Muse headband.
I've
Um,
heard of it, but I haven't tried it.
yeah, so it's like a little band. You
Mhm.
sit it on your ears, and it senses your EEG. So it senses
Mm.
brain waves, and it can tell when you're getting into a more relaxed state. And they have all these different sounds so that when your brain starts to get more active, like let's say you're listening to the waves will start to be more
Yeah.
right. And when you get really quiet, the sounds settle down, and you start to hear birds, and you can choose the style of birds. And it gives you
Oh,
feedback real time. And I find, interestingly, well, I awakened one night, and I was very asleep. I barely woke up, and I was like, oh, this is what it feels like to be asleep. And for me, it felt like I had sort of cotton squished on my head. And I was like, wow, I should remember this for when I'm meditating. And then the next time I meditated, I'm like, last night I had this experience of this is what sleep feels like. And I'm going to try and reproduce that, because when we go into a deeper meditative state, it's very similar to sleep, right? But waking sleep.
mm-hmm.
So when I did that, I got a bunch of birds, right? So I got this feedback immediately, which I thought was quite cool. So something like the Muse headband is nice because it gets the biofeedback, and it's almost like gaming meditation. Dare I say gaming
Yeah, yeah,
meditation?
yeah, yeah.
Um, the other app that we have to mention when we're talking about sleep is the Curable app. The Curable app helps people with chronic pain, and
Mm.
not just chronic pain, but I'd say anybody who has complex medical illness, Lyme, mold, could benefit from the Calm app, because there's so many symptoms, and it helps you do this mind-body connection so that you begin to be more in control of symptoms that feel like they're out of your control. And I hear my puppy coming to see me. Hello, how was your walk? She's on a walk. I can't take the camera down to show you to her, but I wish I could. She's so sweet. So the Calm app and the Curable app will help with pain. And a 6-week trial of the Curable app has a
Mhm.
very good track record of reducing people's pain, even if it's been intractable. So
Wow,
um,
that's
the
exciting.
yeah, and I mean, we've been chatting now for about 30 minutes. I guess the other things that I think about, what about magnesium? Do you suggest magnesium for people, Robyn?
Oh, for sure.
Yeah, I mean, I
Oh,
think it can help.
absolutely. It can. It can. It's not, yeah, and again, it depends on the severity of insomnia, right? Like you're saying, is it really something that warrants a sleep study by the doctor and kind of investigating if that's sleep apnea or something else? But yeah, it does need to be looked into. But if it's mild to moderate, what we're talking about here today, I think can be really effective. You may have known about some of them, but not others. So pick one of what we're saying, right? Or more if you're going to dive right in and see what happens.
Yeah, yeah. Yeah, the big, the first supplements that I consider for people, it's great if you can do it without supplements. And so that which brings me actually to, let me just talk a bit about sleep restriction for those of you who have insomnia, right? Um, Insomnia is caused by lots of different things, but especially if people are having frequent awakening, one thing that we can do is consolidate the sleep. And the strategy in order to consolidate the sleep is step one, find out how many hours you're sleeping a night. Step two, set a wake up time that fits within your circadian rhythm. All right. If you typically get up at 11 in the morning, don't set a wake up time for 8, because that's not gonna work, right? It's not gonna work. And the first couple of weeks of sleep consolidation, usually it's hard. Okay, it's hard, but you can do it, right? It's worth it if you're having insomnia. So you set your wake up time, and I would not set it more than an hour away from your current wake up time. We can always move it, like we can nudge it using light. But first, we want to get you sleeping consistently for a set period of time. If you have to do some daytime morning sleeping, it's got to be dark in the bedroom. So you find out how much you're sleeping, and you set your wake up time. And the goal will be, let's say you're sleeping 6 hours total. We like that to be longer because we know less than 6 hours is linked with all kinds of problems, medical problems. So we want to sleep more than 6 hours. 7 to 8 is preferable, right? Um, and so let's say you are going to get up at 6. Then you're going to say, all right, if I'm getting up at 6, I'm going to count back the number of total hours I slept. So that's going to be midnight. And I'm going to add 30 minutes for my fall asleep time. And I'm going to go to bed 30 minutes at 11:30. Right? Right. And then you got to get up at 6. Okay. Whether or not you slept throughout that time. Okay. So that's what makes it hard for some people, because some people are like, I'm lying in bed. Right. But if you do this for a 2-week period, until you are sleeping 85% of that time, like, more than 80% of the time you're asleep. And then you go to sleep 15 minutes earlier, because you're going to build up some sleep debt over that period of time. Now, it's not easy. You'll hate me. You're going to hate me when you try this, but it works. It 100% will work. And if you right now, if you're having a lot of mood challenges, maybe get those under control before you try this, because we don't want us to sleep deprive somebody who's having a lot of mood challenges. But this has been shown to work. The other thing about the bed is for 2 things: intimacy and sleeping. It's not for other stuff like watching Netflix. You want to do other things outside of the bed, so that you train yourself that when I'm in bed, I go to sleep.
What's
Um,
reading? Is
yeah.
that not good, right? Reading? Does that count? Is that good?
I don't think I would not recommend doing it in bed unless it works for you and you're getting adequate sleep already. And if you're not, then no, because it makes your body say, oh, it's okay. I sleep when I'm in bed. But
Tension,
I
right?
mean, I read. I'm in
Read,
bed.
yeah.
Yeah. So, I think that we've hit the high points there, and we'd love it if you guys drop any comments below, or if you have questions, those will come to us. Um, you can find us, Robyn, at the Alzheimer's Alternative, me at Feel Good Functional Medicine and Paloma Health.
My
And
website is actually different than the name of the company. So it's endcognitivedecline.com.
oh, okay. And cognitivedecline.com. Love that. All right. And that's where you can find Robyn. All right, you guys. So make sure and check out Dale Bredesen. What's the name of that book again? Dale Bredesen wrote?
Ageless Brain just came out on
All
Amazon.
right, The Ageless Brain. Check that out, everybody. And we're going to be doing this every Friday. We're going to talk, it's Feel Good Friday. We're going to be talking about how you can optimize your brain because the brain, yeah, it's kind of the most important part of you, right?
Command
So
center. I always call it the command center.
it's the command center.
Yeah.
So thanks for joining us and thanks for checking out this video. We would love it if you'd like and subscribe to our channels. That'll be great. And then you'll get alerted when we go live again. All right, everybody, have a great day.
Weekend.
All
Bye, guys.
right. See you guys.